Is kidney transplantation better than dialysis? For those who tune for the first time, I am Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients or their relatives with kidney problems or kidney-related diseases to have better information, to understand better the disease, so they can manage it better together with their own doctors or with me if they choose me, so they can have less worries and complications. The topic of today, as I mentioned, is quite interesting. I'm trying to answer or help you understand a little bit more about is kidney transplantation better than dialysis. The simple answer is yes for most patients, but let's go and discuss this in detail. So kidney transplantation can indeed prolong and improve the lives of patients with kidney failure. When compared to dialysis, either peritoneal dialysis or hemodialysis, the outlook of patients choosing a kidney transplant is much better. They tend to live longer. Also, kidney transplantation can give patients a better quality of life. Most patients refer actually higher levels of energy because indeed dialysis can be tiring and draining. Patients who have gone through dialysis know that change when they have a transplant done. Most patients also comment that kidney transplantation allows them to regain their freedom to do many other things that they used to do before starting dialysis, or things they used to enjoy before developing total kidney failure and starting dialysis. Thus, kidney transplantation appears to offer patients the best chances for rehabilitation in many aspects of their lives, including the medical, the family life, work or student life, social life, and any sort of leisure, including freedom for traveling. Although true, they need to take more precautions regarding catching an infection because they are taking medications called immunosuppressants, which are used to prevent the rejection of the transplant. Patients undergoing a kidney transplant are subjected to less dietary and fluid restrictions than dialysis patients, which increases the quality of life significantly. Kidney transplant patients also can have greater fertility, and many patients actually become pregnant after transplantation when they try and fail while on dialysis. Importantly, kidney transplantation increases the chances of greater sense of personal fulfillment with a fuller and more harmonious personal, family, and social and work life. Many patients are actually able to reinstate their profession or previous work life after transplantation, which in some cases is severely affected after starting dialysis. Mention all that good about transplantation does not mean that these goals cannot be achieved by dialysis patients, especially when taking care of themselves, living a frugal life, have an active life, and a positive mindset. Yeah, but it is true that the bulk of patients with a kidney transplant tend to do better than the bulk of patients on dialysis. So that's why we as doctors tend to advise as first choice patients to go for a transplant. In different videos, we will discuss a little more about transplantation. But true, in both modalities, transplantation or dialysis, there are exceptional or extreme cases. I am talking about those patients who lose the transplant the same day, or they have major complications during the surgery, or dialysis patients who actually live for decades, having a very active and productive life. But as I mentioned, most patients do better on kidney transplantation, no? But kidney transplantation is not a cure for kidney failure. It's not also going back to the previous health status before having total kidney failure or before starting dialysis. Kidney transplantation has also some disadvantages And patients do experience some symptoms as side effects of the anti-rejection medications and some complications. Immunosuppression, those drugs I mentioned to prevent rejection, because they work by dampening the immune system, because the immune system is the one that attacks the transplant, thinking that this is something foreign to you that can be dangerous to your body. They attack it like in the same way they attack foreign virus or bacteria that are causing an infection. So we use these medications to dampen the immune system to prevent the rejection, but at the same time, we are dampening, we're diminishing your potential to fight infections. So they are well known by increasing the chances of developing infections. Also, they have some metabolic problems. They can increase the risk for diabetes, high cholesterol, or similar metabolic derangements. And even patients with immunosuppression can have a heightened risk of developing cancers. This does not mean that it will happen in all patients. It happens in some. It depends also in many other factors, exposure to smoking, genetics, etc., environmental exposures. Or in many occasions, because transplant patients are subjected to thorough assessments, screenings, checkups, they can be detected on time and they can be, in many occasions, cured. But true, many cancers grow also faster in patients having immunosuppression. But again, despite these side effects that it sounds a little bit scary, as I mentioned, it does not happen in most of the patients. And yes, there are significant side effects to consider, but most patients live longer and better on a kidney transplant than if remaining on dialysis. Because dialysis itself brings a lot of hassles. Forget about the hassles of being linked to a machine. It can bring many complications, cost, medical complications like heart problems, infections that can occasionally shorten the life of patients or bring lesser quality of life. But remember, this is actually more complex than what I'm just mentioned, and all these discussions and advice must be individualized to your particular medical situation, your lifestyle, your preferences. In Francisco Kidney Medical Center, we provide our patients and their families with the rationale, pros and cons of all these therapies, and we weigh the options for them so they can take the best possible decision. So if you need our help, you can contact us. I wonder if there is any question. If you don't have any now, you can do it later. Just remember to support us, liking this, sharing it. You can also like my Francisco Kidney Medical Center page because it's sponsoring all this, yeah? So I hope it's useful. If no questions now, so I'm Dr. Francisco wishing you the best possible health. Take care, bye-bye.